the rest of treatment, once the detox was done, consisted of medication and a little bit of diary filling and CBT work with a community psychiatric nurse. And there's a few things were mentioned. Well, I brought up the concept of therapy. I was aware that some of the stuff that happened to me in earlier life might be relevant to my drinking in the here and now, and that wasn't really supported at the clinic. That therapy would have a part to play, and also I think accessing it might have been a challenge. The other thing that was brought up, I didn't bring this up, the consultant brought this up, was mutual aid. There was actually, at the same time I was visiting the clinic, on a particular day, there was a mutual aid meeting actually running in the same building. And the consultant asked me about what I knew about mutual aid, and I said, not very much. I'd had some patients that had gone to AA over the years, but I really didn't know anything about it. Which, again, as a GP looking after people with alcohol and drug problems, you might think I could have been better informed, but I wasn't, I'm ashamed to say. So he asked me about it, and I said, well, I've never been. And he said, well, I'm not sure it's going to be right for you. And I'm thinking back, I can't think of the reason for that. I don't think I was even curious enough to ask why it wouldn't be right for me. So I kind of just accepted that and moved on. As it turns out, later in this story, that it was exactly the right fit for me. It was connecting to other people was a huge part of my eventual recovery.